What are GLP-1 medications and how do they work for weight loss?
Sure. GLP-1 medications have been in vogue recently. They are more and more popular by the day. Probably 1 in 8 Americans are on GLP-1s right now. So very popular, like you said. In essence, they are medications that work on your brain, that work on your stomach, on your pancreas, on your liver, numerous roles, all working on the hormone pathway of your hunger. Okay. In the brain, they slow your hunger drive. In the stomach, they work to decrease the emptying of the stomach or how quickly it processes food. And then in the pancreas, it works on the actual hormones that your pancreas is normally secreting to change your metabolism. All of that can lead to weight loss.
And how does this medication or these medications compare to surgical options in terms of like long-term success?
Yeah. So as you know, with the popularity, a lot of people are finding success with the medications. Typically, over the course of the year, and some of the company's best studies, they get about 12 to 15% total body weight loss. Surgery, bariatric surgery, we think about sleeve, gastric sleeve, or a Roux-en-Y bypass. For those, you get much more significant weight loss, as well as kind of sustainability over time. With the medications, you have to continually take them on a monthly dose and titrate it up to something that you're tolerating. And so over time, that can be a financial burden. And from a total weight loss standpoint, bariatric surgery gives you 3 times the weight loss to GLP-1 medications. It also has better improvement on comorbidities, things like blood pressure, cholesterol, diabetes, whether it's coming off of insulin or going into remission from your diabetes, as well as heart disease. So overall, if you compare just strictly head to head, surgery outcomes are better with more financial sustainability as well. Okay, the upfront cost is going to be higher with surgery, but the two equal themselves in about 16 to 24 months, depending on insurance coverage. Okay, and so if you just look long-term sustainability, surgery wins. Okay, as far as long-term success, everyone's different. The amount of patients who stay on the medications is variable, and the frequency and dosage long-term is still being kind of worked out. Over time, most patients who come off the medications tend to regain that weight. Not all of it. About 60 to 70% of that weight comes back after stopping the medications. And so for that reason, it feels like surgery is more sustainable as well.
Interesting. Who would be a good candidate for a GLP-1 and who might be better suited for surgery?
Yeah. So within our practice, within our group, our providers, we try to look at the patient, see what they're going through at the time. Not everybody is a candidate just for the medications. Not everybody is a candidate just for surgery. It needs to be a tailored approach to the patient and what kind of their life is like at the time. The medications typically start with a BMI of 27 or greater. Traditional surgery's initial threshold, kind of entry point, is a BMI of 35 or greater with comorbidities. Okay. In between there is an endoscopic sleeve gastroplasty that maybe we'll talk about in a little bit. But as far as initiating GLP-1s, it depends on the patient. And more often than not, it's a combined approach, whether that's treatment up front to optimize the patient towards surgery, or after surgery, if their weight loss curve isn't quite where we want it to be, using it as an adjunct to get down to their goals of weight loss or treatment of their comorbid conditions.
This one's a hard one. You've got to be careful about how you answer this one.
Yeah.
Are there any long-term concerns about relying on medication alone?
That is tricky. The medications in their initial intent was being used for diabetes, the treatment for diabetic patients. Their newer role is within weight loss. And so as more and more patients are on these medications solely for weight loss. That long-term benefit still needs to be studied. In comparison to bariatric surgery, which has been around for decades, we are at the very cusp of these medications. We see GI side effects. We know nausea, vomiting, cramping can be common with the GLP-1 medications, whether it's titrating up to a dose where a patient's comfortable or transitioning off of them, depends. But the long-term effects are still kind of unknown, still kind of in the dark.
Can a GLP-1 be used in combination with surgery?
They're often used in combination with surgery. We alluded to it a little while ago, but some patients aren't candidates for surgery up front. We may start them on medications, work on bringing their weight down, which often improves some other conditions to the point where it's safer or optimizing them for surgery. Okay. In a similar fashion, we may use them after surgery. Okay. Right now, it's probably 15% of patients after a bariatric surgery may see benefit from starting a GLP-1 medication. And so using them in concert is beneficial to the patient, as well as their medical conditions that they're trying to treat.
Is using it post-op because of the hormone factor essentially, or what is? I don't understand. If you had the surgery, why you would also need a GLP-1?
Right. A lot of patients, when we study their weight loss curves after surgery, they may struggle with some of their food choices. They may have increased hunger drive after they get used to the initial dietary restrictions or portion control. And the medications, a low dose of them, can really influence that hunger drive to the point where they are full longer and kind of get back on track.
That makes sense. How should a patient decide if they should go with medication or surgery?
Yeah, I think the best way would be to come in and kind of have an assessment and figure out what their goals are, what their other medical conditions are, and tailor the approach to them. And some patients it will be medication, some patients it'll be weight loss. A lot of our patients, it's a combination of the two.
And what type of follow-up or support do you offer your patients?
Sure. With GLP-1 medications, they need to come into the office regularly as we are building up to a suitable dose for them. It's basically monthly progression. As they're coming in, we're checking on them, ensuring that they're not having any side effects or complications from them. From there, once you're to a titratable dose, you can typically back off the follow-ups from a provider standpoint, but you still need dietary counseling. You're still going to need an exercise regimen, so you have to stay in contact. From a bariatric surgery standpoint, we typically see them leading up to surgery. We see them 2 weeks after surgery, 1 month after surgery, and then basically every 3 months, again with dietary counseling and also exercise support sprinkled in throughout that time frame. And so it's a good analogy. If you're going to the dentist, you're going to floss beforehand. Same way, if you're coming in to see us, if you know that an appointment's coming up, you're going to ensure that you're staying on track with your diet, with your exercise. And so the frequency of visits, the more touch points you have, the better you're going to do overall.
I'm glad you brought that up because in post-care, it's why do you need to come back so many times? But that makes sense. Why? Because you want to be on track.
It adds in that extra accountability. Okay. A lot of people do this together with their partners, with a family member, but having that extra support, knowing that you have to come in and be accountable for your decisions that you make on a day-to-day basis is very important.
And where do you see the future of obesity treatment going?
Yeah. So right now is really an exciting time for obesity medicine as well as bariatric surgery. In Alabama alone, about 40% of our patients, or 40% of our population is obese. Okay. Bariatric surgery as well as these medications are still underutilized. And as more research goes into the GLP-1 side of it, more patients will address their obesity that may be a hard topic to discuss previously. There's more light shed on the whole obesity epidemic. And from there, patients can make more informed decisions about the rest of their life.
Totally.
Yeah.
Now we're finished with the standard questions. What do you think about GLP-1s being like a designer drug that you can go online and ship to your house?
Yeah, so we see that as pretty good advertisement. I think it's great in that people are recognizing, and there's more, I don't want to say discovery, but there's more acknowledgement of obesity as an issue. Some of the questions I have with those companies is, are they doing the right counseling beforehand? Are they doing the right assessment beforehand? Or do you just sign up and give your address? And more often than not, it seems like it's sign up and give your address. Despite maybe a quick 10, 15-minute telehealth visit, I think the right way to do it is a full assessment, going through comorbidities, having dietary support there. So it's not just the medications, not just the package that arrives in the mail. You actually are combating the diet, the exercise, as well as the medications. Okay.
I think it's interesting that also like all these accessible places online sell compounds also. So you don't really know the source of truly where it's coming
That's
from
right.
or what's inside the compound, where if you go the doctor route, then you're going to get an actual tested,
Right.
approved medication.
That is a big toss up and a big issue that some of these larger medical companies have had with compounding pharmacies, even local compounding pharmacies that you expect to do a good job and follow state and federal regulations. It's a big hot topic in how are we controlling this? How are we policing this? How are we ensuring that patients aren't hurt or harmed in any way from this? And right now, the trade-off is financial. You can go to these compounding pharmacies and obtain medications at less cost than some of the big name brands that have fought through all the red tape with FDA clearance and everything. So that's tough. It's very tough. And most patients that we see are making financial decisions surrounding their medication choices. And that is an issue that hopefully in the future, as the novelty wears off, the prices may change as well. But competition as well within the medical markets will drive that price lower as well.
Well, I think also it's a little bit sort of nerve-wracking that the studies aren't available yet for long-term for all these people who are taking just generalized GLP-1s
Right.
without knowing the implications for later on.
Right. Yeah, it can get heated, but a lot of the studies within these medications weren't necessarily performed on the same patient population that are taking the medications. And so the initial study or trials that were done were not on your class 2 or 3 obese patients. They were done on healthier patients to see what the effects were. And so it is a little bit of a question what the future